We'll just do it as it comes.
Okay, David, I just tried to ask you some questions regarding the treatment and all the procedure, and this is what we have to done, so it's okay.
Yeah.
First of all, I want to ask you regarding the first steps. I mean, can you tell people who will probably wanted that surgery done in the future? What are the main reason for you to do that correction down?
For me personally, the main reason was to have the bow legs corrected was because it affected me personally. It's purely cosmetic in my case. I've been told that there's no problem with my knees. I'm sure there might have been a problem in the future because my legs were badly bowed. But I've had this problem that I've been aware of ever since I was 13, and I am now 64 and be 65 this year, and it's too long to live with this problem. So I've always wanted something done with them, but never found anyone that was able to do it. I did several years ago go to a doctor in England, and I was told that he told me that he couldn't do anything for me and that they wouldn't get worse. Well, I know that over the years they've gradually been getting worse, and for some unknown reason last year, September time, I happened to look on the internet and I wrote in bow legs surgery. I don't know what made me do it. I think it was finally getting to me again. And I came across the Laddiston clinic and I read all about Dr. Veckledge and also saw all the photographs on the site. And I was absolutely amazed at what he could do. And I checked all of the sites and read a lot about it, and I was absolutely convinced that he could help me. And that's what really decided me to try to have it done. So I left it for about a week or more before I spoke to my wife about it, Shirley, and she had a look on the site, and after she'd looked, she said, "You ought to have it done." So I contacted the clinic and spoke to the manager, Pavel, and he answered lots of questions for me, and we both decided that it was the right thing to do to have it done. So I spoke to my two children, and they were quite pleased that I was going to have it done for me, and they understood why, and they said go ahead. So I made arrangements with the clinic, with Pavel, to have it done, and we arranged them to come at the very end of December, the 28th of December. So,
do you know anything about Ukraine before? I mean,
no, we didn't. We hadn't really seen much of Ukraine anywhere, not in books or on the television. And so we were looking forward to coming to see what it was like. We had hoped we'd be able to see some of it while we were here. And it was very nice because when we came, I thought I would just be in the clinic and I would then have the operation, because the operation was arranged for the 30th. But when we arrived at the clinic, Pavel told me that we would have a chance to go to Kiev the next day, which we were very surprised. And so both Shirley and I went with Pavel, and we had a day in Kiev, which was very, very interesting and really surprised us with some of the buildings, especially the cathedrals, were wonderful. We around, which was very good, and we came back to the clinic after that, which was quite a long day we had, and then I had my examination with Dr. Beckledge, and he said everything was okay for the surgery the next day.
Dr. Beckledge knows that you are an engineer, so the technique that Dr. Beckledge explained to you, did you understand all the details he told you about the technique, all the things?
Yes, I fully understood. I always thought, before I even looked on the internet, I always thought that it should be possible to have something done. What, I didn't know, but I couldn't understand why nobody in England would do it. And when he explained to me what it was that he was going to do, it all made sense. The only thing he hasn't explained, and he keeps a secret, which I find very interesting, is the procedure he uses for cutting the bone. But there is no cutting of the flesh at all, and I'm still trying to work that one out.
So it's still there's problem to you need to think about it.
I'm still thinking about it, but I'm not too worried about it because I know it's been done, because I saw it, the cut on the X-ray, and it's absolutely amazing to see that there's no flesh being cut at all, and yet the bone has been cut ready for the correction.
Yeah, you're right. And what do you feel, I mean, before the surgery, did you nervous a little or something before the surgery?
What, nervous at all?
Yeah.
No, not at all. No, after I'd read about Dr. Beckledge and I'd seen what he'd done for some of the patients, well, of all his patients, and some of them were children, and I knew that I was going to be going to a surgeon that was capable of doing just about anything. And I never felt any nerves at all, not before, not on the day of the operation. I've not had any worries at all. He's a very, very easy doctor to speak to, very good, and you know from what he does, he takes a pride in his work, and you feel so confident with him.
I see. How do you felt yourself after the surgery, when the anesthesia is finished, I mean, because we should tell our future patients what a level of pain they could expect it after the surgery is done.
Well, I chose to have the anaesthetic that lasts for 6 hours because I didn't want one that lasts over a period of days. I believe the other choice was 3 days.
Yeah, that's right.
Yeah. Well, I chose to have the 6 hours so that I could be able to move a lot freer after the surgery. And so when I came from the surgery and finally came round, I couldn't feel any pain because I was still under anaesthetic. But as that gradually wore off, I was very surprised at how low the level of pain was for myself. I had expected it to be considerably more pain, and I was in some pain, but I could bear it. And as the anaesthetic wore off and it got a little bit more, the nurses gave me an injection, and from then on I haven't had much painkillers at all. And I was really pleasantly surprised at the level of pain was good.
Yeah, you're right, Regan, that the pain is quite low. It's not something you couldn't feel with that.